As a physician, I'm well equipped to handle medical emergencies. And I've come to realize that the techniques are not magical. That with a little bit of knowledge and instruction, you too can and should learn how to handle many of the situations I'm faced with every day. But are you prepared for a medical emergency in your home? It's something you generally don't think about. But considering that the very life of a family member or friend could suddenly be put in your hands, a little knowledge and preparation could become one of the greatest acts of love that you could give. I'm Dr. Henry Heimlich, and this is a program in which I outline easy-to-follow life-saving procedures for some very common household emergencies. Review this home safety guide with your family every few months, and you'll be able to respond competently and calmly. There's no place for panic in any emergency. Of course, every situation is important, even if it's not life-threatening. So I'll also demonstrate medical treatment for a few minor situations which can occur around your home or office. And because it's always better to prevent accidents, I'll share some safety precaution tips. But remember, in any emergency, when in doubt, call for help. I urge you always to contact your personal physician as soon as possible. Familiarize yourself with your local telephone emergency numbers, such as the Rescue Squad, Poison Control Center, and hospital, and post those numbers near your phone right now. By taking these simple precautions, each of us, grandparent to child, is better prepared to meet an emergency situation calmly and with logic, caring, and love.
They call his maneuver the Heimlich miracle, responsible for saving more than 10,000 lives.
When a person is choking on food, or a child is choking on a small object or toy, they lose the ability to speak or to breathe, and that is because their airway is blocked. Very quickly, they'll turn blue and then fall unconscious because oxygen is not getting to the brain. The choking victim will die in 4 minutes if you do not act immediately to save his life. You can't wait for an ambulance or a doctor. You must immediately perform the Heimlich maneuver. The principle behind this proven life-saving technique is pushing up on the diaphragm compresses the lungs and like a bellows blows out the object that's blocking the airway. The principle remains the same, though there are several ways to do the maneuver. Each has a different purpose in different situations. But first, learn the Heimlich sign, which is placing your hand to your throat. This signals, "Help me, I'm choking." When you see someone doing this sign, to be certain, ask the victim, "Are you choking?" If she nods her head yes, begin the Heimlich maneuver immediately because you have a 100% diagnosis. If she's standing, position yourself behind the choking victim, put your arms around the victim's waist. Feel for the bottom of the rib cage with one hand. Make a fist with the other hand and place the thumb side of that fist against the abdomen just above the belly button and definitely below the rib cage. Grasp your fist with your other hand and press inward and upward with a quick thrust. If it doesn't work the first time, repeat the maneuver until the object is expelled, saving your friend or family member.
If the choking victim is sitting down, then kneel behind their chair and proceed with the steps of the maneuver in exactly the same way.
Suppose either of these two conditions exist. The choking victim has fallen unconscious and is lying on the floor, or you are too small to reach around a large choking victim to apply the Heimlich maneuver. The method I will show you has even allowed children to save their own parents or other adults.
With the victim lying on their back, face upward, kneel astride their hips with your knees on the ground. Place one of your hands on top of the other. Place the heel of the bottom hand just above the navel and again below the rib cage. Press inward and upward with a quick thrust.
If it doesn't expel the object, repeat the Heimlich maneuver again, several times if necessary. You see, in this position, you use your body weight to perform the maneuver. It's very important, particularly if you live alone, to learn how to save yourself with the Heimlich maneuver. Remember, with your breathing blocked and your speech affected, there is no time or ability to call for help. You can use the maneuver on yourself by placing your own fist in your abdomen and pressing inward and upward, just as if you were doing the Heimlich maneuver on someone else. If that's difficult for you to do, then lean against the back of a chair, or it could be the side of a table or the edge of a sink, any nearby firm object that's not sharp. Then press your abdomen down against the object.
A choking infant requires yet a more delicate method in administering the Heimlich maneuver. Place your infant on his back, on either a table or on the floor. Put your 4 fingers together, the 2 index fingers and the 2 middle fingers to make a pad. Place your fingers in the same spot, above the belly button, but below the rib cage. Then, very gently press inward and upward as you would similarly do on an adult.
Learn these basics and practice them. The proof that anyone can learn and perform the Heimlich maneuver is the fact recently a 5-year-old child saved a 6-year-old while his panic-stricken mother looked on, not knowing what to do. He was never taught it the way you have now had the opportunity to learn it. Yet because it's so simple, it worked. One sure way to be prepared to treat injuries that occur in your home and office is to have a well-equipped first aid kit. A good first aid kit needn't be fancy, but it must have the tools necessary to be effective, and it must be kept where you can find it in a hurry. Nothing inside requires a doctor's prescription, and nothing is expensive. In fact, the first aid kit for your home or office should only cost about $10, and it should look like this. Have a roll of 2-inch gauze bandage, and 1 or 2 each of these 4-inch and 2-inch sterile gauze pads for cleaning and covering wounds. You should also have some non-adherent, non-stick patches for raw surfaces, some cotton balls, and cotton swabs, helpful on cleaning wounds. An old bedsheet can be cut up and put into your kit and used for making bandages, slings, and tying on splints. Suppose you have to help someone with a sprained arm. Just cut a piece of an old bedsheet in a large square using your blunt-tipped scissors and make a simple sling for their arm before taking them to the hospital for further treatment. These tongue depressors can be useful as small splints. You would need a couple of strips of tape to secure a small splint on, say, a broken finger. See how easily useful common household things can supplement the needs of your first aid kit.
You should also gather a tweezers for extracting splinters and a roll of 1/2-inch wide adhesive tape, a blunt-tipped scissors, and an oral and rectal thermometer, some rubbing alcohol for sterilizing your instruments, spirits of ammonia for fainting. Calamine lotion is excellent for relieving itching insect bites, rashes, and sunburn. A mild antiseptic is good for cuts and scrapes. And especially important for certain types of accidental poisoning, syrup of ipecac, particularly if you have young children. Finally, you'll need some aspirin or its equivalent.
Please remember, first and always, to read the instructions on all medications. Be sure they're used properly and that they're safe for you to use. Don't mix medications or take any medication if you already have a pre-existing condition, pregnancy or illness, which warrants a doctor's prior approval. Having a well-equipped first aid kit will save precious time in emergencies because all your needs are accessible and organized. A ready first aid kit provides a sense of security, a gentle reminder that you're always prepared against the unexpected.
Quick tip number 1, bee stings.
Serious reactions to bee stings are primarily due to allergies. We call this an anaphylactic reaction, meaning that a person is overly sensitive to bites or stings. If you're sensitive, your doctor may give you a kit to carry with a syringe of adrenaline that must be taken within 5 to 10 minutes of a sting. It's a good idea with any bee sting to remove the black stinger with the tweezers. Don't squeeze it out with your fingernails. Then simply wash the area of the sting with soap and water. Afterwards, a cold compress or a soothing lotion can be applied. Antihistamine can be taken to help relieve the itching.
Quick tip number 2, wood splinters.
The concern with splinters, other than the hurt, is that any foreign object under the skin can result in infection. To avoid this, right after you get a splinter, begin by washing the wound thoroughly with soap and water. Then sterilize a needle in a flame, and after the needle cools, wipe it off with rubbing alcohol or a dry piece of sterile gauze. Do the same with the tweezers you use to grab the splinter and pull it out. If the splinter is below the skin, work the very tip of the needle under the splinter and lift until you can grab it with the tweezers. Wash the wound again with soap and water and cover it with a small bandage.
Quick tip number 3, animal bites.
The first thing to do when you're bitten by a pet or other animal is to thoroughly wash the area with soap and water to remove the animal's saliva. Then treat it as you would any other wound. However, if you're not sure that the animal has been immunized, see a doctor immediately because of the possibility of rabies. Don't let that scare you either. The new rabies vaccine has practically no side effects. There's really no excuse for an accidental poisoning to occur in the home. Yet, the U.S. poison control centers receive over 1.5 million calls every year. And each year, somewhere between 5,000 and 10,000 deaths are attributed to accidental poisoning. 85% of these cases involve children, especially children under the age of 5 and toddlers under the age of 3. So I'd like you to listen very carefully. Find the number of your local poison control center. It may be in the first pages of your phone book. If not, call your doctor, your hospital, health department, or fire department. Write that number in a very conspicuous place near your telephone, and do it right now. This time invested could save critical minutes if you have a poisoning emergency. In such an event, you must get quickly to your phone and use that number. First, let's understand how we can prevent accidental poisonings. Hopefully that number won't ever have to be used. Our day-to-day housekeeping tasks are made easier by a variety of commercial cleaning products. But these liquids and powders are frequently concentrates of toxic substances. Substances that, if swallowed, can cause permanent disorders, if not death. The problem is that to a child, the colors, package shapes, and scents can be irresistible. If these chemicals are in your home and accessible to your children, they're in danger of becoming poison victims or casualties. Make a thorough whole house search. Also, consider other homes, grandparents and babysitters, for example, where your children may visit, play, or stay. The same caution must also be taken with household medications. Prescription drugs, such as sedatives, sleeping pills, and tranquilizers, and non-prescription drugs, like aspirin, are both common hazards and great dangers. Children are most at risk for these accidental poisonings in the hour right before dinner. The U.S. Poison Control Center refers to this as the arsenic hour. It's because children are restless and hungry at that time. So it may be wise to leave them a slice of apple or a cracker right out on the kitchen table.
If or when a chemical or medication is swallowed, first, identify the product or substance taken. Be wary of the recommendations on labels. Frequently, this information is outdated or just incorrect. Second, give the victim 1 or 2 glasses of water to dilute the poison. Above all, never give them an oily substance to drink. Next, go quickly to the phone and call your poison control center. Have the products you identified with you. Those experts will want to know the name of that substance, its exact list of ingredients, and your best estimate of the amount taken. They'll instruct you on what to do next. You may be told to use your syrup of ipecac to induce vomiting. If so, position their head lower than their hips so the vomit will not be inhaled into their lungs. If you are referred to a hospital emergency room, go at once and take the bottle of poisonous substance with you.
Now, perhaps surprisingly, the second most common cause of accidental poisoning is carbon monoxide. This is a gas that comes from the exhaust of an automobile, but it can also be emitted from a gas stove or a wood fire in the fireplace. Carbon monoxide is an odorless and tasteless gas, and when inhaled, it sneaks up on you, making you first feel drowsy, followed by unconsciousness. A cherry red appearance is typical of carbon monoxide poisoning. We're in added risk of danger by our confinement in closed rooms, especially during the winter months. So you must adequately ventilate enclosed areas and have regular household mechanical checks and maintenance on your furnace, stove, and fireplace. In the event of a carbon monoxide poisoning, the steps are, first, shut off the source of the carbon monoxide. Then get outside for fresh air and return to drag the victim outdoors. Then perform mouth-to-mouth resuscitation while someone else calls for help. Once revived, the victim should receive professional medical treatment to guard against any resulting injury or illness.
Quick tip number 4, poison ivy.
In the spring and summer, we're more subject to casual contacts with poison ivy, oak, and sumac plants. What causes allergic reactions stems from the oil on the shiny, waxy leaves of the plants. If you wash with soap and water before the oil takes effect, it may prevent a reaction. But the oil can remain on unwashed clothes and poison anyone who touches them. To relieve the itching, try a hot shower, calamine lotion, or antihistamines. If a few blisters are evident, warm water compresses applied for brief intervals may also provide some relief.
Quick tip number 5, sunburn.
One of the most commonly misunderstood burns is sunburn. Though we all joke about our holiday sunburns, there are some very serious consequences of overexposure to the sun. Sunburn also advances the aging process in your skin, causing wrinkles, thinning, a loss of elasticity, and permanent discoloring. So I strongly encourage you to use sunblock and sunburn prevention products that are on the market. But if you do get a mild sunburn, calamine lotion is an excellent medication for treatment.
Quick tip number 6, electrical cords.
Guard against your toddler putting electrical cords in his or her mouth. Even if the cord is not frayed, the child can chew on it and end up with a live wire burn or death. Should you find your child in such a situation, first unplug the cord and then remove it from the child's mouth. The reason being, an electric current could cause the mouth to lock shut on the wire. So periodically inspect your wiring and keep the kids in safe areas. A commonly occurring emergency in the home and office, ranging from minor to life-threatening, is burns. If you're ever in the position to treat a burn accident victim, as always, remain calm. Only by remaining calm will you be able to properly evaluate and assist in the victim's care. This is what you should know and remember. Burn treatment requires that you first consider the degree of the burn. Secondly, the location of the burn. And third, how much body area has been burned. Here's how to evaluate the degree of burns.
A first-degree burn is painful and results in irritation and redness of the skin. A second-degree burn is even more painful, producing blisters, or the top surface of the skin peels away. A third-degree burn is the most serious because the skin's surface is destroyed and deeper tissues are exposed. It appears either white or charred and is surrounded by second-degree blisters. Although you would expect a third-degree burn to be extremely painful, it is often signified by numbness because of nerve damage.
Typical first-degree burns are caused by momentary contact with a hot object, such as a radiator, a hot plate, a stove, hot water, or steam. This is what to look for. The skin reddens, it's painful and sensitive to the touch, and sometimes there'll be swelling. Do not put ointments or so-called first aid creams on. Simply apply a cold water compress or submerge the burn in cold water. This alone should relieve the pain and help diminish the swelling. The blistered or loose skin wounds of a second-degree burn should be treated in the very same manner, with cold water and/or compresses. Now, do you remember my saying that the location of the burn was important? Well, any time a second-degree burn involves the face, the hands, feet, or a joint, this will require emergency attention. The danger of facial burns is that vision may be impaired. Inhaling hot fumes may cause lung damage. And the danger to hands, feet, and joints is that scarring may restrict mobility. Concerning the amount of body area burned, if 10% of a child's skin or 15% of an adult's skin is burned, seek immediate medical help because they're likely to go into shock. In judging what percent of a body has been burned, I go by what is called the rule of nines. The head is equal to about 9% of the entire body area. The front and back of the chest are each 9%. Each arm is 9%. Your abdomen is 9%. The entire buttock is 9%. And finally, each leg is 9% on the front and 9% on the back. Remember this rule of nines, and you can judge whether 10% of a child's or 15% of an adult's skin has been affected. The far more serious third-degree burns involve deeper exposed tissue with blistering skin around it. The same is true of most chemical burns, electrical burns, and radio frequency and microwave oven burns. Often, third-degree burns are more serious than they first appear, so get help immediately. And if you're in a place where you can't get help, follow these steps until help arrives.
Apply cold water compresses. Remove their charred clothing unless it is stuck to the burn. Do not tear away any of the tissue. Then, give the victim plenty of fluids because shock occurs through the loss of body fluids. You can make a fluid solution by mixing 1/2 teaspoon of salt, 1/2 teaspoon of bicarbonate of soda, and 1 quart of water. The burn victim should continue to drink these fluids slowly until help arrives. And lastly, cover the individual loosely with a blanket in order to preserve their own body heat.
Burn victims do suffer discomfort. Even minor burns can be disfiguring or limit mobility. But more anguishing could be the consequence of any delay in your correct and calm treatment or care. This knowledge can go a long way to help make someone in a crisis more comfortable, even save their life. Better yet, by taking simple precautions now, burn situations may never have to occur.
Quick tip number 7, chemical burns.
If a substance or chemical like drain cleaner gets into the eye, sit the person in a chair with his head back and eye open. From at most a few inches away, slowly pour lukewarm water directly into the eye. This will rinse and flush the irritant free. Treat chemical burns on the skin in the same way, by liberally rinsing with warm water. In either case, the affected area should be quickly examined by a physician.
Quick tip number 8, electrical outlets.
Electrical cords are another red flag item. Children are known to partially pull plugs from wall outlets, exposing the plug to fingers, and the child to electrical burns or even electrocution. Safety devices are available for your accessible plug-in fixtures. If you have children, please protect them.
Quick tip number 9, scalding.
A burn danger to both children and adults is entering or slipping into a full bathtub without first testing the temperature. You can receive severe burns by just a momentary submersion, and the occurrence is far more common than you may think. Please be careful. We all learn early on that blood and its circulation are major life forces. Parents also know that emotional upset occurs, particularly in children, at the mere sight of blood from cuts or wounds. So, in addition to physically treating bleeding, it's equally important to instill a sense of calmness and confidence. The example of how you respond will help shape your child's reaction to emergency situations for the rest of his or her life. A little trick I learned many years ago is to encourage your child to look at the bleeding. At the same time, talk to her about her wound while you clean it.
Look, it's bleeding. Look at it. It's good because the blood washes away all the germs. We'll get it all cleaned up and then get all the blood away, and then it can start healing again.
Be honest. Tell her she may feel a little burning because the skin is broken, but that will heal. That way, the lesson in this experience, the one they'll always remember in any emergency, even years later, is to remain calm, and you'll be able to help yourself and others. The basic principle to go by in case of bleeding, no matter how substantial, is that if enough pressure is applied, the bleeding will stop. If a cut has just occurred and it's deep enough, you can try to close the edges together and place a temporary bandage or Band-Aid across it. If bleeding is from a larger surface, apply pressure directly to the wound. If the bleeding is profuse, use gauze or a piece of cloth and hold it firmly until the bleeding stops. If you haven't anything to put in or on the wound, just use your fingers to constrict the blood flow at the site. To cleanse a wound, flush the inside of the wound with nothing more than cold water. If it's not possible to close it because it's more of a gash than a cut, wash the wound a little more thoroughly, particularly if it's been open for some time. Then do not dry bandage it. Each time you remove dry gauze, some of the healing tissue will pull off and start the bleeding again. Either use non-adhering dressing or a gauze combination with sterile petroleum jelly. Of course, the methods of treating bleeding depend on the severity of the injury and the place on the body where it occurs.
If the bleeding is bright red and occurring in spurts, with each heartbeat, then you know that an artery has been cut. If the blood is dark red and flowing slowly and evenly, then a vein has probably been cut. A gentle oozing of blood is likely due only to a surface injury, breaking or bruising the capillaries within the skin.
In caring for a more seriously injured person, first control the bleeding. Secondly, dress the wound firmly enough to stop the bleeding. Be careful not to cut off the circulation beyond the injury. If the bleeding persists, apply more gauze and bind it again. If this still hasn't controlled the bleeding, then suspect arterial bleeding, and this is what you should do.
Press lightly on the artery between the heart and the bleeding site, but as close to the bleeding site as possible. You can feel the beat of the heart as it pulses blood through the artery. If the bleeding is from the hand, press with 3 to 4 fingers on the wrist, just like taking your pulse. If bleeding from the arm, press on the inside of the arm, between the 2 muscles and about halfway between the armpit and elbow. On the leg, press on the inner side of the thigh, in the crease of the groin. Here, you can use the heel of your hand. If from the scalp, press nearest the bleeding site or against the arteries located in the temples.
Finally, and only as a last resort, you can use a tourniquet. Its danger is in being applied too tightly or for too long. So if you do use a tourniquet, fold it over several times so the pressure is spread over a larger area and it doesn't cut into the tissues. Always place it between the wound and the heart. Then wrap and secure it. Remember, a tourniquet is dangerous, so in its use, do what you must to control the bleeding and release it intermittently. Your treatment will have safely sped the victim onto healing.
Quick tip number 10, nosebleeds.
Nosebleeds can develop from an external blow to the nose, from harsh sneezing or coughing, from breathing dry air, and, of course, from picking the nose. To treat a nosebleed, do not lie down and don't tilt your head back. Just sit up quietly. You can easily control simple bleeding by pressing your finger on the lower side of the nose. Though it may be uncomfortable, try not to blow your nose for a while until it is healed. If the bleeding is chronic, lasting more than 15 minutes, it may signify an artery injury, high blood pressure, or other underlying concern, and that should have the immediate attention of a physician.
Quick tip number 11, black eyes.
We sometimes regard the look of a black eye as somewhat comical, but actually it may indicate a serious underlying injury. Like a bruise, a black eye is due to blood collecting in the surrounding tissue under the eyelids. If there's no vision problem, you can quite simply and safely apply a cold compress during the first day to control any bleeding and swelling. Thereafter, warm, not hot compresses will help lessen the discomfort and discoloring. Don't hesitate getting medical attention if you have difficulty seeing or if a black eye develops after a head injury in which the eye was not directly hit.
Quick tip number 12, cooking burns.
You're inviting tragedy at home if the handle of a pot on the stove is extending over the side of the stove and within reach of your small child. One pull and the result, an extremely severe burn. Put pots on the back burner when you cook. Avoid accidents. Safety is that simple. These tips and procedures are guidelines to help make your home or office a safer place to live and work. Review this program again and again with your family, and you'll reinforce what you've learned. Remember, the best way is to prevent medical emergencies. The precautions outlined in these segments are simple steps that will greatly reduce the risk that you or a member of your family will suffer such a medical emergency. However, if a situation arises, you'll now be able to handle it calmly, quickly, and correctly. What we have done is to review the basics. To first, remain calm, recognize certain telltale signs, decide on a course of action, properly administer treatment, or get professional medical help. We should never presume to take our lives or health for granted. And though you should now feel better prepared in an emergency, I hope you'll never have to use these potentially life-saving methods. This is Dr. Henry Heimlich, wishing you good health.